Good afternoon, Lacey. I'd
Good
like to,
afternoon, Elizabeth.
good afternoon. Um, it gives me an absolute pleasure to speak to you today. And thank you so much for participating in the 11th edition of the Medical Device Safety Monitoring and Reporting Program. This event will bring together shakers and players in the market, in the medical device industry. This event will be looking at conforming to ever evolving EU MDR regulations by creating robust reporting frameworks. We'll take a dive into best practices for risk, complaint, adverse safety, evaluations, and post-market surveillance. We'll be navigating or seeking to get best practices in navigating regulatory compliance and guidance for superior markings, manufacturing, literature review, and utilization of AI devices. And finally, we will be taking a look at how you formalize FDA requirements for continuous evaluation, assessment, and reporting advancements through real-world evidence and data. Today, I'd like to introduce you to Lacey Gigante. She's Director of Post-Market Surveillance at Integra LifeSciences. Welcome again, Lacey. So today, Lacey, I wanted to talk to you a little bit about, what you'll be sharing with our audience on the 17th and 18th of January 2023. One of the questions I have here for you is, how would you define the relationship between post-market surveillance and risk management?
Thank you, Elizabeth. So, post-market surveillance is certainly my area of expertise. However, naturally, risk management is ingrained in our processes in everything that we do. So it's a passion of mine to ensure that risk management is considered in all of our post-market surveillance activities. And it's really something that I'm looking forward to speaking to at the event in January. And my focus will really discuss how at Integra we incorporate risk management into our post-market surveillance activities to ensure that we are continuously monitoring patient safety, performance, and quality of our devices throughout the life cycle of the product.
Okay, awesome. So you talked about risk being your forte. So how would you identify risk within the post-market surveillance realm, and what mitigation strategies do you employ when identifying those risks?
Yes. So as I mentioned, risk is part of all the post-market activities that we do, whether it's complaint handling, adverse event reporting, health hazard evaluations, post-market surveillance reports. We are always looking at risk in every aspect of the work that we do. The strategies that we deploy are things such as trending. So, at the conference, I'll talk a bit about how we perform our trending and we assess our occurrence rates and the overall risk acceptability for our products. So we will talk about those types of strategies that we look at, whether it's in a complaint investigation, an isolated incident, or a trend of events that we're seeing in the field. So there's many different strategies that we use, but at the end of the day, the strategies all come together to assess the overall risk acceptability for our products.
Okay. Thank you so much for explaining and addressing that question. So you talk about risk again. What would you consider, to be newly uncovered risk, and what processes or documentation is needed to update management?
Sure. So, I think the one thing I want to mention is we're talking a lot about risk, and the authorities, and we've seen over the last several years, the authorities and the notified bodies are very interested in understanding the risk of our products. Patient risk, safety risk, those are all significant areas of focus for the regulators and the notified bodies. So when you ask about uncovered risk, that's something that is certainly not an ideal situation, because when you're designing a product or launching a product, you want to ensure that you've identified all the potential risks that could happen with your product. Now, if you've missed something and you see in the real world that there is a risk with your product that was not identified, then certainly there's steps that we take as an organization to ensure that we account for those risks in the post-market data that we're seeing by doing certain processes to assess those risks and really understand the criticality for that risk to the patient, to the user, and whoever might be coming in contact with that device. So there's several things that we would do, and certainly things such as, and every company calls it a bit differently on their processes. At Integra, we do a health impact assessment to assess right away the impact to the patient. So that's always done right away. And then through there, we then determine whether or not that risk is acceptable or not. Now, if it's not acceptable, then it gets escalated even further appropriately. And that's where we really assess whether or not this risk is appropriate or if we should continue to escalate further.
Okay, awesome. So finally, Lacey, do you incorporate assessments of complaint rates when we're looking at the probability of occurrence into your post-market surveillance strategies? Is that something that you take care of on a day-to-day as well?
Yes, absolutely. So assessing the probability of occurrence is first and foremost a requirement by the law. So the regulations indicate that we do need monitoring the occurrence throughout the life cycle of our devices. This is clearly spelled out in the MDR. There are some areas in the ISO regulations that require this, and then FDA is getting closer to this expectation as well. But at the end of the day, we do this. This is something that is built into our best practices as a post-market surveillance organization, and certainly something that is front and center to ensure that we're monitoring the occurrence rates quite often.
Awesome. Well, I'd like to thank you again, Lacey, for joining me today for this very insightful chat. It's been an absolute pleasure speaking with you today, and I'd like you to continue. I just can't wait to meet you in person at the event in January the 11th, Medical Device Safety Monitoring and Reporting Program. I'd like again to thank you and ask you to continue to enjoy the balance of your day.
Thank you, Elizabeth. It's a pleasure to be here. I look forward to the meeting.
Yes, as well. Have a good day.
Thank you.
You're very welcome. Bye.